Usually would be back and neck pains.
I mean, who doesn't have back and neck pain? Welcome to another episode of Perfectly Imperfect Health. I'm Guan.
And I'm Shell.
Hey Shell, do you know what topic we're discussing today?
Pain.
Pain, yes, one of our favorite topics.
Yours actually.
Yeah, it's my favorite topic. It's my favorite topic. You see, can't even speak properly because I actually get a little bit of pain almost every day.
Every day?
Do you?
Okay, yeah, actually that's true every day. I'm older
you
than
don't pretend, huh?
So
Okay.
I went to I was a gym junkie some years ago,
Yes,
and then now my knee hurts.
Yes.
And then after that I got a bad chair, and then my back hurts until now.
I see you got more pain than
And
me.
then
So you
recently
see,
I did the fighting, so now my arms pain.
Yeah, so much pain, right? So
Pain, yeah.
I think we should bring a
We
professional.
need to talk to someone
Yeah,
professional.
so let's welcome Dr. Elizabeth Tan from the Department of Pain Medicine here to discuss pain with us.
Hi.
So, Dr. Liz, are you ready to talk about pain?
I guess so.
Okay, so coming from me lah, when I reach a certain age, like every day, almost every day there is a little bit of pain, like here and there, ankle, knee, neck, everywhere lah. So is that natural or normal actually?
I think we all go through some type of pain throughout our life. There will be periods where we injure ourselves, or there will be periods where we have pain that we cannot explain, and that's totally normal.
This is totally normal.
Yeah, people get it all the time.
Why?
So it really depends, because sometimes we strain things, we pull things, and sometimes, of course, as you get older, you can get degeneration as well.
Right. So it's not just like a us going old thing.
May or may not be related to your age lah.
Okay.
But when we're younger, it seems like our bodies are invincible.
Yeah, when I was 18, 20, I never had any issues with pain.
Yeah. So I guess it's really important that we start protecting our bodies early.
Yeah. How do we do that? How do we protect our bodies actually?
Yeah, enough sleep, eating well, making sure that your mental health is good as well, and not overstraining your bodies, but at the same time also keeping active.
So actually, I wanted to ask, because Gwen was talking about age, right? Is it like we feel more pain as we get older, or we are more sensitive to pain as we get older?
So it really depends, because I have very old patients that do not have any pain. Even though they might have some degenerative process going on.
And when you say very old, you mean about?
50.
I shall not name any
50 and above.
limits, because age is only a number.
Yeah, very sensitive. Yeah. Especially when our young seniors here.
Yeah.
Yeah, okay, yeah. So age doesn't matter, and because when you're old, you can be old, you won't have any pain. So I guess it also depends on how well you take care of your body, and you don't put your body through too much pain. Like for me, if I do a lot of sports and I don't take care, I got ankle sprain, I don't go and see a specialist, I don't see a doctor, then you might have some kind of long-term repercussions lah.
Possible.
Yeah.
It's possible. If you don't give your body enough time to rest after any injuries, and you just keep going, there is a possibility that injury will become worse and worse, and potentially become a chronic pain condition.
Right, so because you specialize in pain, you're a pain specialist. I think this is like one of the first time I've heard of this term and this occupation. So when do people actually need to see a pain specialist? Because if I got leg pain, I go and see the leg doctor, like ortho doctor. If I got back pain, I will see ortho doctor. If I got headache, then I go and see maybe a neurologist. So when do we need to see a pain specialist?
Okay, so if let's say you have been having pain for a while, you have been on medications, you've tried various treatments. Sometimes the specialist may also refer difficult to treat pain to us, because we have a wider range of medications that we're able to prescribe.
You got all the drugs.
One could say that. We do also perform procedures that may be targeted to your condition. So our job scopes all overlap. So we all target, we may be managing the same type of pain, but sometimes our approach is slightly different.
Okay. Can we go back to more basic thing, right? Because Gwen was talking about you being a pain doctor. What exactly is pain? What does it mean?
Okay, pain is a sensory sensation that your brain experiences. It's like a stimulus that your brain experiences that may be suggestive that somewhere might be injured. Like there might be a tissue injury, there might be a nerve injury, and it's more of like a protective mechanism that your body is trying to tell you, hey, there's something that's not right. Maybe you want to check it out, or maybe you want to avoid doing certain activities.
So it's like a signal that you shouldn't just brush away.
Yeah, you should definitely have a look at what the problem is.
Because like guys, right, you're usually like,
okay,
okay.
I don't know whether it's a guy thing or it could be like a macho
One
thing. I don't know, but because I think you will agree that different people have different threshold of pain,
Yep.
and it has nothing to do with age. It has nothing to do with your gender. Right? You just born with it, or like for example, if I do this to her and then
There's
she
nothing.
doesn't feel,
Yeah,
but when I
didn't
do
feel
another
that.
person, it's
Yeah.
pain. So different threshold of pain.
Oh,
Why
people
are
getting
there different
injections
thresholds?
as well, right?
Injections. Some people are more afraid of injections.
Yeah, so
Yeah.
everyone differs. It's
Yeah.
different for everyone. It's hard to. So that's why we use things like pain scores. So there are different types of pain scores, but the one we commonly use in hospital ranges from 0 to 10.
Okay.
0 meaning no pain,
Mhm.
10 meaning the worst possible pain you could imagine, and somewhere in between, where would you rate your current pain score? And what is the intensity of the pain you feel it is now?
Right.
So we take the pain score based on face value. If you tell me your pain score is 5, then I
Mm.
accept it as 5.
Ah.
So if you tell me your pain score is 7, I accept it as 7.
Yeah.
And the number itself has a rough gives us a rough gauge of how severe your pain is.
Mm.
So normally, if one would say that the pain was 1 to 3, we would
Yeah.
think it's mild pain.
Mm.
4
Right.
to 6 is a moderate type of pain, and
Right.
above 7 and above is severe.
Yeah.
But of course, if we've been following up with you for a while,
Yeah.
and our patients, who, especially the chronic pain patients, they've been having the pain for years,
Yeah.
and their baseline pain has always been a 5 or a 6.
Mm.
So we actually follow the trend more. So if the pain is worsening now, it's now an 8, 9, I will certainly be very worried. But now it is maybe a 4 from a 6,
Yeah.
then I would be more comforted that something has helped in their pain.
Okay. I get your explanation, but I think there are some people who say that okay, 10 is like a gunshot,
Mhm.
and 1 is like what pinprick or
Yeah.
something like that. Do you use that to explain how to gauge 1 to 10 to your?
Who has experienced
to
a
your
gunshot?
exactly, but there's someone who said that before, like
Do
gunshot.
you?
Like there are people who
Oh.
describe that if 10 is like a gunshot, then 1 is like pinprick. So I don't know how is that how you describe it to your patients?
I've never used the term gunshot because
Nobody
like
get gunshot in
Michelle said,
Singapore.
I don't think anyone in Singapore has.
Okay, so
had
what is
very
a 10?
few.
How would you describe
Yeah.
it?
The most excruciating pain you could imagine.
You have felt in your life.
You have experience
You
or
may not
imagine?
even have had to experience what you can imagine.
You can imagine.
Like someone slicing you with a knife
Yeah,
slowly?
that could be a 10.
Have you kena slice with
No,
slowly? How
but
would
I
you
watched
know
it
how-
like Saw,
how
like the
would you know how
movie
it
Saw,
feels?
you know, like it.
But how would you know how
Okay,
that
I
feels?
mean, actually, I've like had tattoos, so it's depending on which part of your body it hurts
okay,
more. I actually want to
okay.
ask you about that as well. Yeah.
Yeah, possible. So,
Yeah, it really feels like somebody's slicing you.
Okay.
so
Yeah.
okay.
if you think that
With a
you
knife.
possibly could still bear
Mm.
with the pain, then I wouldn't call that a 10.
Oh.
Yeah, and imagine 10 is like unbearable type of pain, like
Like you're gonna-
screaming type of pain.
Blackout.
Yeah, you see, so
Yeah,
that's
maybe,
where
yeah.
the different people can endure different levels
Yeah,
of pain.
definitely.
Yeah,
Yeah,
that's
it's
true.
like my mother. Right? I can already tell you that her 10 is different from my 10. Like she can like recently her toe is like I don't know become like something that's super disgusting and like it feels like damn painful and she still can walk and
Yeah.
she still function properly. If it's me, I think I'll be screaming and
Yeah,
so different people, different threshold again.
exactly.
How about-
different people, different thresholds? Yeah.
How about gender? Can women take more pain? That's why we can.
Yeah,
give
because
birth.
they say that women have been through
Well.
childbirth. People,
That's a topic that might be a bit contentious, I think.
but then is it true or it's not been
There's not
proven
any-
or?
I don't think there are any major studies that can really prove that. But I don't think I've actually searched up this topic either, so it's,
Right.
I can't really give
But
you an answer.
since women go through that
childhood.
quite high level of pain every month,
Mm.
I would think that the threshold of pain gets higher. Can you build up your threshold of pain?
That's a good question.
So it depends.
Mm.
So if someone has had pain for a long time, it
Mm.
could work either way.
Yep.
Either they from their words they get used to the pain, they
Mm.
know that's
Yeah.
this background pain, and they sort of learn to live with it. On the other hand, there's the group of people who have had pain for so long that there's what we call a wind-up phenomenon.
Mm.
Their nerves are so wound up,
Mm.
every single stimulus that they have that may not have been so painful is now
Right.
magnified.
Oh.
So this is a term what we call allodynia,
Mm.
which is that's a scientific term, but it basically means that something that is not painful is now sensed as though it's painful. So that is one of the things that could happen if you have a wind-up phenomenon.
And is the wind-up phenomenon a psychological thing or is it a physical thing? Or both?
In a very simplistic way, your nerves are sending signals a lot more than it should.
Oh.
Because it's been so wound up from the chronic pain that they've been having.
Okay.
So it could work either way.
I just know that I feel pain almost every day, and yeah, I don't think it's normal, but I think it's a sign of aging. It's just a natural process of aging, I guess.
I guess, yeah. But also, like what Elizabeth was saying, it depends on what you do as well, your lifestyle.
Yeah.
So when you go to the doctor, will the doctor ask you to describe your pain?
Yeah.
And then the doctor will also ask you the adjective to describe your pain.
Oh yes, like is it a throbbing pain?
Oh, yeah.
Is
Shooting
it a
pain.
shooting pain? Is it a dull ache?
Yeah.
I can never
Yeah.
understand what it is, to be honest. Like pain is pain to me. Right?
No, there's different kinds.
How like what?
Like if somebody like this kind is
what?
just
Squeezing pain?
yeah.
Squeezing pain,
It's
okay.
it's like
Tight
a
pain.
Tight pain?
yeah, and to me like ache is like like it's there all the time.
Okay.
Whereas a throbbing is like
Mm.
it's painful,
boom,
it's not.
boom,
It's
boom.
painful,
Right,
it's not.
right.
Would that be correct?
That's
What about
right.
shooting pain? What's shooting pain?
Okay, so we usually say shooting pain is like an electrical sensation.
Electrical sensation.
And I personally
Yeah.
have
Oh.
experienced it when I was pregnant.
Oh,
Yeah,
wow.
so like suddenly an electrical shock going down my leg.
Oh.
And
wow.
that's normally a sign of nerve pain.
Nerve pain.
And that's very sudden and quick.
Yes, sudden and quick. May not be. Okay, it comes on quickly, but it may not go off quickly also.
Oh.
So is it something that's pressing on your nerve? Does it mean?
Probably.
Right,
so
right.
it's either
But-
likely a nerve type of pain. So that's why if they ask you, is it an electrical sensation?
Mm.
They
Oh.
are trying to find out if you have a nerve type of pain, like
Oh.
a nerve component of your pain.
Right.
Speaking of nerve, somebody told me that if you get a massage, some people say like a massage is good if they press hard enough until it hurts. But someone told me that's not true because if you do that, you're injuring the nerve.
Depends.
Depends.
It depends. It depends. Some people do get relief from getting that massage, right? The
Right.
pain.
The
Yeah, some people
painful,
love
yeah.
pain, right?
Yeah.
They love pain. Like if not pain, that means it's not
Shook.
not working.
You know what I mean? I feel that way about exercise after you do like some weights.
Yeah, that's the
Yeah.
muscle
The
ache.
next
lah.
day, the muscle ache.
That one different. lah.
That's
Yeah.
different.
Yeah.
It depends because it depends on the type of pain. So if during the massage you're feeling shooting pain down your arm, probably I would ask them to massage somewhere else, or maybe not so much force.
Okay.
Right.
But
What-
if it's like a muscle type of, that kind
Yeah.
of very shook kind of feeling,
Very
then
shook,
yeah,
ah.
that's totally
very
fine.
sure. Okay. Have you had that before?
Yeah, I do
Yeah.
enjoy a massage once in a while.
Okay.
You also, right?
Yeah, I think everybody likes massages, but I
Yeah.
think it's the point that if the masseuse
It's too hard.
it's too hard, then after that you feel a different kind of pain, and that kind of pain is
Yeah.
a not shook one.
That's not a great idea then.
Yeah,
Yeah.
I've had those as well.
Yeah.
Yeah.
Tell the auntie like whoa, that's like usually I just go and then they realize it's too hard.
Okay.
Yeah.
Okay. Okay. Right. So what about those pain that comes from injuries lah? How do you treat it? Because normally they will go to like orthopedic surgeon.
Mm.
After that they'll come to you because they can't get rid of the pain.
Yeah.
Yeah, so really, we work very closely with orthopedics, the physiotherapists, acupuncturists. We do work very closely with them, and depending on the type of injury, can it be treated by just conservatively, meaning just watch and wait, rest, give a period of rest,
Mm-hmm.
or whether they need to do any interventions. So this one really depends on the type of injury.
Okay, and then would there be a timeline of how long you would have to wait before they see you? So supposing I had injury and I go and see a physiotherapist, and I'm very good. I do all my stretches and everything. Like, is there an estimate how long should I wait till the pain doesn't get worse, but it doesn't get better till I come and see you?
So I think if you've given it a good enough go. So firstly, if it is intense pain,
Okay.
you should probably see someone first to just
Right.
make sure there isn't something more sinister, like a broken bone.
Oh right, yeah.
Right, or like a
Broken
torn ligament.
A
that
broken
you
bone,
need-
that one definitely cannot tahan, right?
I mean, there are
No.
people who have had
Really?
hairline fractures, for example.
Okay, hairline lah,
hairline,
who
okay,
have
okay.
managed. And some of these fractures, for example, I have had patients who have had hairline fractures and they went to see a masseuse,
Oh,
and then it made
Right.
it worse.
Right.
So it's hard to tell, but
Yeah.
of course, if it's something that you feel is getting unbearable, you should
Mm.
probably you don't have to see a pain specialist at the point first. You
Right.
can see a GP first.
Yeah.
And if they
Mm.
feel that this requires escalation to a specialist, then
Right.
they will usually do the referral.
What is the most common kind of pain like people come to you for?
Usually would be back and neck pains.
I mean, who doesn't have back and neck pain?
Yeah, so that's a very common condition.
Yeah.
Yeah. And most of the time it's from degeneration.
Right.
Oh.
Oh,
Or
degeneration.
nerve, or possibly a prolapsed disc. Prolapsed back herniated disc that's
And maybe
pressed
I
onto a nerve.
think maybe I need to go and see the specialist
You mean
because I've got a shifted disc.
Okay.
what is that?
Shifted. It's not dislocated.
slipped.
It's not slipped. It's just shifted.
Okay.
Yeah. So I am
back.
okay after a few years, but then recently I went back to the gym again. Then maybe I pulled it again. Then I start to feel that back ache again, and then you will feel the numbness in your thigh. Yeah. So maybe it's time for me to see a specialist.
But you've been doing, is that why you started doing yoga for
Yeah, I
many
started
years?
doing yoga.
That helped?
Yoga helped. Yeah,
It
I think
helped,
yoga
yeah.
helps my back pain. But because
Okay.
I overexerted in the gym again, so I don't know. Is it time to see a specialist?
So it depends. It depends
Yeah.
on how your pain is like and whether you feel you can cope with it. Of
Mm.
course, if it's bothering you a lot, you
Mm.
can't really get around doing what you want to do, and you want to see if there are any other treatment options, then it's worth seeing someone, a specialist, whether it's from the pain side or the orthopedic side. Both are probably appropriate.
I think it's the same thing for your knees also, I guess.
Yeah.
A lot of people, as we age, the knees go pretty quickly, I find. And I think it's a matter of how much can I put up with the pain, right?
Yeah, that's
Yeah.
right.
How much it affects my daily life.
Yeah.
Yeah, but like we are all taught from young, Asians, I don't know whether it's probably an Asian thing or is it just my mother thing, like we are told to endure pain. Probably not the right thing. Yeah.
Just tahan.
Yeah, because I'm quite sure you see a lot of patients that come to you, then you'll be surprised at how long ago they already had the pain.
Yeah.
Right?
It's true.
Yeah. What's that most extreme case? Like 6 months pain, 1 year.
There are people who have said that they've had pain for 10 years.
No,
Yeah.
10 years. Like where?
Yeah.
In the back or
Yeah,
everywhere?
in the
Is it the
body.
long zhong tia, everywhere pain?
In the back, in the neck, a lot of there are so many areas that
Yeah.
they complain of pain.
And is it because like they waited? Because at first it wasn't, that the pain score was very low, and then
Yeah,
it got worse and worse. They
Yeah.
cannot tahan, then they come in.
yeah. So that's usually the trajectory. They've been having pain for a while. They
Right.
sort of figured out some coping mechanisms, but it's reached a point that whatever they're doing is not working anymore.
What kind of coping mechanisms? Massage, pills, what do they do?
Exercise.
Yeah. So physio is one of them. On top of physio, there's also acupuncture
Ah,
that we have here.
right.
There's a pain
Acupuncture.
psychologist as well that we have in our clinic. They do a very thorough patient assessment to see what kind of techniques would be appropriate for them. So there are things like mindfulness, deep breathing
Mindfulness, deep
techniques.
breathing. Yeah, I do all
things
this
that can help
during my
someone
yoga,
to
yeah.
cope with the pain
Okay.
and to improve their mental health as well.
So it's mental and physical, to speak. It will help improve your overall body condition. Yeah.
So it's important to also, I mean, like the body and mind
Yeah.
are connected, right?
If you are having a rough patch in life,
Yeah.
in general, pain tends to be perceived worse
Oh.
versus when you're having a
Is that
general
true?
patch in
Okay.
life.
So psychologically it affects as well.
Yeah, so either
Oh.
way, of course, the pain could make your mood worse.
Definitely,
But when
definitely.
your mood is worse, your pain is perceived worse as well. So
Right, yeah.
being mentally healthy and happy is also very important.
Oh, that's where the psychologists come in.
Yeah. We always encourage our patients to have good social support outside as well.
Right. It seems to be the case for a lot of things.
Yeah.
Yeah, because we spoke to a lot of doctors with a lot of conditions, it seems to
Yeah.
be the social part, the
Yeah.
mental part, it all helps.
And
Yeah.
sleep.
And sleep.
And
Sleep
sleep,
is the most
definitely.
important.
Yes,
sleep.
definitely.
If you have a good
Affects
sleep.
pain also?
Yeah.
Yes,
Oh.
Very, very
I
good.
good factor.
But wouldn't there be a cycle though? Because sleep helps you with your pain, but then because you're in pain, you can't sleep.
That's
Yeah.
true. That's true.
Yes, yeah. So that is a very common complaint that a lot of
Yeah.
patients have.
Yeah.
Because of the pain, it's affecting their sleep,
Mm.
and that's also one of the reasons why they end up coming to see us. If they're just coping with it in the daytime, sometimes they're okay. But once it started affecting the sleep, it's become a big problem to them, and that's why they feel the need to escalate to come and see a doctor about it.
I mean, okay, depending on what kind of pain you have, does it get worse during the night?
Yeah, so it depends on the type of pain. Some types of pain may be worse at night. Some types of pain.
What kind of pain?
Why is that so? Yeah.
What kind of pain?
So there are some type of nerve pains that tend to become more sensitive at night.
Right.
It's hard to, we don't really know the reason for it, whether it's related to maybe at night it's colder, with the aircon it triggers, or if it's just because at night you're not distracted anymore.
Yes, I think that might be the
just
case as
lying
well.
in bed, thinking about your pain.
Thinking about the
And
day.
it's getting worse and worse. Whereas in the daytime when they're out, people actually are happier because they're distracted, there are other things to think about. So most people will say that they experience the pain worse at night. Not sure whether it is because the pain is actually worse at night, but they are certainly thinking more about it now.
The other day I was like taking a shower and then I was thinking, God, my back pain always hurts so much worse. Like
when you're showering?
No, in the daytime it's okay. But then when I shower like 8 and 9 at night, then I was like, oh, the pain is there and it's so. But then, like you said, during the day, because I'm busy with work and walking, maybe I don't really.
You don't notice it.
Don't you have the same experience with your chronic pains?
My pain is all the time. No, like for real, like it's like when I wake up, right, the moment I need to get off my bed, right, and when I step on the floor, right, I feel my ankle pain.
Oh my gosh.
And then it takes a bit of warming up to get my ankle to maybe like 60-70%. Then after my shower, then finally it's 90%. You know, is that normal? Probably not.
It happens.
Oh, it happens.
Yeah, quite a few of our patients do say the pain is worse when they wake up, and as they get along, maybe after half an hour, the pain does improve.
But with this kind of pain, do you need to see a specialist?
So it depends, like we mentioned before.
I realize it always depends.
Yeah, because it really depends on what the condition is.
Okay. Right, so in order to cope with pain, I mean, I take some kind of medication like ibuprofen and stuff like that. Is it okay to take this kind of pills?
So we have to see what type of medications you're taking. There are some medications that might be a bit safer to take in the long run, and some that are a bit less safe. So ibuprofen and what we call the non-steroidal anti-inflammatory drugs. So there's ibuprofen, diclofenac, etoricoxib. These drugs are within this family, this group of drugs, and the risk of taking this in long term, meaning, for example, you're taking it every day for a month or more, there is a small risk of it causing damage to the kidney.
Right.
On the other side, we have things like paracetamol. So if you take it within the safe limits that is written on the box, then in general it is quite okay to continue that. There are other drugs that require prescription.
The harder drugs.
Like codeine.
Like those are the ones that.
Tramadol. So these are opioids.
Correct.
The same family as morphine.
Right.
Oxycodone. These require prescriptions, and I think these are the drugs that you are worried about for addiction. At the dose that we give, and if truly you're taking it for the correct indication, which is for pain, addiction probably is not a huge problem, but there might be what we call tolerance. So if you take it for a long period of time, it's no longer having the same effect that you like it to have. You end up needing to take more and more, and then you might end up going up on quite high doses.
What about I take the medicated oil or some lotion and then I massage my joints myself?
In general, topical medications like medicated oil are quite okay. They're quite safe as long as you avoid any areas of broken skin or open wounds.
Right. Yeah, because that's what my yoga teacher told me to do. He said improve blood circulation. Does it help to get rid of? I mean, is it temporary relief for the pain? It's not
Most
long
of the
term.
time, I would say it's temporary relief.
And then how about temperature, like ice pack or hot lamp or something?
So it also that depends on the type of condition, the type of pain you have. But it's one of the prescribed treatments that physios do. Hot pack, heat packs, or cold presses. These are treatments that our physiotherapists also teach.
Interesting one you mentioned, acupuncture, TCM. Like how do the needles help deal with the pain? Without being too technical, but enough for us to understand.
So traditional Chinese medicine has a very different teaching. So they have things like acupoints and qi. which of course I myself am not very familiar with.
Flow, okay. You know, right? Qi.
Flow.
Right, okay.
So we do in SGH, we do have an acupuncture center that we
Yep.
refer a lot of our patients to for acupuncture. Pain,
Right.
specifically for pain, but they also do for other conditions if necessary.
Right.
Okay.
Our
Yeah,
patients do benefit significantly from that.
Significant. Oh, that's good.
There are studies
Interesting.
also to show that there is benefit in using acupuncture in certain types of pains.
But how do you know when to actually recommend these patients? Is there a profile to recommend them for
So
TCM?
lower back pain.
Oh, acupuncture, sorry.
Lower
yeah.
back pain is one of our most common
Right.
conditions. Neck pains can
Okay.
also benefit from that.
So, I guess to wrap up this part, when we want to do self-medication, right? Like you said, there are so many kinds on the shelves. How do we go about choosing something?
Okay. So the safest ones would probably be paracetamol based,
Okay.
but we also have to look at any extra ingredients that we have. Some ingredients may include antihistamine type or things that may make you a bit drowsy.
Okay.
Yeah, some of them may, like you said, have caffeine for
Yeah.
headaches. So, but in general, taking that long term usually doesn't really harm within the safe limits.
Okay.
Safe dosages usually doesn't harm your kidneys, for example. So still fairly safe drugs.
Okay.
Things like ibuprofen, diclofenac, etoposide, these should be taken only in moderate to severe pain for short periods of time, maybe within a week, 7 days.
Oh, okay.
But shouldn't be taking it for a whole month consecutively.
Okay.
Right. Thank you so much for talking to us about pain. Any key takeaway that you want to let people know about pain?
So I think that it's important for us to know that in life we are going to go through pain at some point. We are all here to help. There are so many various ways to help as well. Not just the pain side, but the GPs, the various specialties also are trained in managing pain. So of course, if you would like to seek an opinion, don't be afraid to ask. We will not downplay symptoms, because we do believe that this is something that shouldn't be taken lightly. Pain is there as a warning signal for our body.
Yeah, because I think not many people actually know there's this thing called pain medicine and pain specialist. But maybe after this episode, people will go and see one. So thank you so much for your time today, Dr. Liz.
Thank you for
Right.
having me.
So we'll see you next time. This has been Perfectly Imperfect Health.